Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. On today's episode of Face the Facts, we're going to be talking about when you might have an open versus a closed rhinoplasty and what that all even means. So just to give you a little bit more information about the terms, open usually always means open. Closed, you might also hear the term endonasal. It's the same thing. But what the differences are between them is how we, as a surgeon, can go about doing anything and everything we need to do with your nose. If it's an open approach, that means that there will be at least one external incision, which is usually right here. And then it allows us to basically open up the nose so we can see and do everything that we want. The open approach tends to be preferred for really complicated cases like pretty much almost every revision case you can imagine. If there's something with really difficult crookedness or very intense tip things that have to be done, basically, it is the workhorse of how you can accomplish and do everything with rhinoplasty. Conversely, going to the closed approach, in the closed approach, you will only have internal incisions, as in you won't see any stitches on the outside, but there are still going to be incisions, of course, so we can get access to everything. And in this situation, we don't actually have as much exposure, so that's why it's called closed. And you can do a lot with a closed rhinoplasty, but what you are trading it for is you have a lot less control of certain elements because you are not seeing everything. So therefore, some degree of it is a little bit of guessing, and some degree of it is a little bit of feeling, and it's not quite as precise as if you had the ability to open up the nose. However, of course, why might you want to go closed versus open? The biggest thing is that whenever you're opening up the nose, you are disrupting a lot of natural things that exist in the nose, like certain ligaments and connections and things like that. And so that can, of course, lead to a longer healing process, longer recovery time with the open approach versus a closed approach. So that would be kind of the biggest advantage of why you might want to go closed versus open. But in general, I would say most surgeons are probably preferring the open approach because it does allow a higher degree of precision during the surgery. And generally, when you are doing surgery, you want to be able to control for as much as you can. So an open approach allows for you to do that. I hope that helped clarify some things. I would not be afraid of either the open or the closed rhinoplasty. It's just a matter of what you want and what goals you want to achieve and which option is the best to deliver that for you. My name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery, and I hope you learned something today on Face the Facts.